So, I'm delighted to welcome the chair of the EFP Workshop Committee, Professor David Herrera from the University of Madrid. David, this is the second workshop organized by you. We are in the middle of the workshop, so maybe you can give us or provide some insight what it means to organize such a workshop. When and how do you start your preparations?
Well, this is the third workshop in a row covering clinical practice guidelines. So the first clinical practice guidelines was developed in a workshop in 2018 that was chaired by Professor Mariano Sanz, the previous chair of the workshop committee, and I was the co-chair already by then, so I was participating in the organization. And all the process started back in 2018. So it takes 1.5 years, 2 years before you actually start the development of a clinical practice guideline and the workshop. So it's a lot of things going on before the meeting in person. I would say that the meeting in person that we are having today in La Granja is the end of the process, and the process lasts, 1 year, 1.5 years. So it's a tough process. Many people involved, the workshop committee chairs, methodological consultant, the reviewers, also the participants, because they have been part of the online meetings, and now during these 3 days the most important things will happen because all the recommendations of the guideline will be discussed and voted, and then that will be the basis for the document that will summarize all these recommendations.
So a lot of work and many people involved. So what happens after this workshop, after these days in La Granja?
That's also a very important step of the process. So we will have all the recommendations voted. We will put them together in a document, which is the clinical practice guideline document, that will have to be approved by all participants. It will be submitted to the Journal of Clinical Periodontology, one of the most important journals in the world of dentistry, in which is the official EFP journal, and it will be peer-reviewed as any other paper. And finally, it will be published together with the 13 systematic reviews that has provided the evidence for the discussions. That will be the scientific part of the project, because the guideline has to be adapted to be used in different countries around the world. And that will start whenever the guideline is published, and it lasts 6 months, 1 year. In the previous guidelines, it's been adapted everywhere in the world, South America, Asia, of course, Europe. And hopefully it will happen the same with this guideline. And in parallel, the EFP, the European Federation of Periodontology, will do a communication campaign. So the information about the guideline and the recommendations of the guideline will be accessible for dentists, for dental hygienists, for medical doctors all over Europe. So still many things to happen, but the center of the process is these 3 days in La Granja.
Okay, as you said, this is the third workshop, guideline workshop in a row. Any idea for the next one?
Well, we will stop for a little while the guideline development process, because it's too much work, and we have done 3 in a row. So we now move to more common formats, and we will discuss education in periodontology, because there are many things that have changed in implant dentistry, for example, in the treatment of peri-implant diseases, and also not only in the contents, but also in the formats. And we have all the things connected with the online teaching that need to be discussed. So we have the previous workshop on education in periodontology in 2010, 2009. So I think it's time, 2023, almost 15 years later, to do a reassessment of what we discussed back then and what are the future perspectives of education in terms of contents, I have said, and also formats.
So David, you are not only the chair of the workshop committee, but you also chair one working group 3. What is the scope of this group?
Well, working group 3 is dealing with cases of peri-implantitis. So whenever you have a diagnosis of peri-implantitis, then our group is exploring what you need to do. So we will do this together with working group 4, And we, in Working Group 3, will deal with the step of non-surgical therapy, the first step. And while Working Group 4 will deal with the surgical step that will come afterwards. So in our discussions, we will try to identify which interventions are actually part of this non-surgical step of peri-implant therapy. Of course, we have to clean submarginally. We will evaluate the value of submarginal instrumentations, but there are other things that we will also evaluate. And in addition, we want to understand which should be the endpoints, what we want to achieve, and when we will reassess that. Because it would be very important to know if it is enough to provide non-surgical, the step of non-surgical therapy in the treatment of peri-implantitis. Could be that enough? Or do you need to go also for surgery? Or when do you need for surgery? So our working group is trying to answer these questions, and I hope that it will provide a clear answer that will be very helpful for the clinicians and the patients.
Thank you.